Okay, good.
I just have to look this way. The whole time I'll be looking off.
Is it bugging you?
Oh, are we on? We're just giggling. We're just giggling. Happy Wind Down Wednesday. I swear we haven't been drinking yet. Happy Wind Down Wednesday. Thanks for joining us. Cheers. Yeah, it's like, you know, when they start those like the news programs and they're like talking and then they're like, hi.
We're a little out of practice.
We're here at Paradise with Peyton, who's our amazing nurse injector, and of course my classy sidekick Shannon.
Real classy.
And partner in crime. And we're here to talk about perioral rejuvenation. Yay!
Yay, try and say that 3 times fast.
No, don't. Cheers. All right. Do you have something? You're not drinking wine over there, Maddie.
Yeah,
You got Maddie
Maddie
behind
is
the
too.
camera.
Oh, don't worry.
This is nice, Dr. Weiss.
Yeah,
This is
that's
really good.
And I always like to point out, let's talk about it. What is your? Oh no. And then it's wine o'clock.
And why not?
And on Cloud Wine over here, I'll show hers. There you go. All right. So anyway, welcome. Hope you can grab a beverage of whatever your favorite beverage is and sit down and enjoy a little bit of conversation.
Yeah.
Okay.
I want to talk about this wine first.
Okay.
Dr. Weiss, thank you so much
You're
for
welcome.
bringing in and sharing this beautiful wine. It's from Tooth and Nail Winery, and Dr. Weiss belongs to the wine club. So you have to belong to the wine club to be able to get these wines. And this one, and I always have a hard time with the Spanish,
Yeah.
El Clavileño. It's an El Clavileño white wine, and it is made with it's on the bottle here, Albarino
Yes.
grapes, which are from Spain and Portugal.
Yeah. We wanted to go white because it's hot
Yeah.
here in Phoenix.
This
Like,
is
super
really
hot.
nice and refreshing.
Yeah.
And it has some really cool flavors in it. I wasn't quite sure what they were, so Maddie helped me out by helping me
Thanks,
with my
Maddie.
research. Thanks, Maddie.
You're welcome.
White peach, orange peel, and melon.
I can taste some melon.
Yeah.
And peach, actually.
Yeah. And then it says flavors creamsicle, apricot preserves, and jasmine. And I love creamsicles.
Yeah, well.
So, yeah, this is nice and refreshing for the summer. And it's from Paso Robles,
Yeah, we love Paso Robles.
our favorite region
Yes.
for making wine.
If you ever get a chance to go to the Tooth and Nail winery, it's awesome. It's like this huge castle on a hill, and they have wonderful food and atmospheric.
Can you
Check it out.
stay there?
I don't think so. I don't think they have rooms to stay, but you can stay in Paso. There's lots of really cute places, like Airbnbs and stuff.
Cool. I like it.
Yep, just give you a reason to go.
Yep, and white is fun. We haven't done white in a while. So you want to hear about the specials?
Yes.
Okay, so for August, we have a lot of fun stuff going on. Back to school with AviClear. So AviClear, I'm sure you've heard, is our laser that we have for addressing acne. It's actually a series of treatments. Get $600 off when you treat one area, like the face, or save $1,200 if you're treating like the face and the back. So those are 2 different areas. Limited appointments are available though, so call us and we'll help get you.
We've seen amazing results with AviClear. So, if you are suffering from acne, if you know somebody suffering from acne, this is really such an amazing option now that's available for treatment and can give long-term improvement.
Yeah,
So,
absolutely.
really happy.
And we've been treating people from age 14 all the way up into their 60s.
Yep.
So it's not for just a particular age. And it's for mild acne, moderate acne, severe acne. So it's not just for people who have bad acne. It's for people that are tired of it, or maybe they don't want to go down that road. Maybe mom and dad had acne. And
Or they
maybe,
don't want Accutane and they're
Yeah.
looking for alternatives. This is a really nice option without all of the systemic toxicity that comes along with Accutane.
yeah, the majority of the calls I get are, that's what comes out of their mouth. We don't want to use Accutane.
Yep.
So they're so glad we have it, and we were the first ones in Arizona to have it.
That's right.
Naturally Beautiful. This involves Peyton and Dr. Weiss. Buy 3 vials of Sculptra Collagen Stimulator and get the 4th one free. And normally we're using 1 or 2 vials, in a treatment, and you're doing at least 2 treatments, that's kind of the norm. So there's your 4 vials. So you're saving $875 with that offer.
Yeah.
I love Sculptra.
I love Sculptra too. I love how natural people look with Sculptra. Patients who do Sculptra love Sculptra.
Yeah.
It is a gradual improvement that you'll see, but if you're really looking to not look filled, but you're wanting to address maybe temporal hollows or hollowing in the lateral face, it's a great way to address that, kind of pulls things back. So it can even help for smile lines, and it just gives you that sculpture glow too, because it's biostimulatory, so it's stimulating growth factors and all of that. So we love it.
Yep. And then we have Let's Get Clear. So time to stock up on your skincare products. Whether you've been slacking off for summer or you're trying to get ready to go back to school, we've got 20% off all of our skincare products. So we have great lines: Elastin, Skin Better Science, Definage, just to name a few of them there.
I didn't know we were doing that. Is it Christmas oh no, it's not July anymore. It's August.
Know,
It's
August.
Christmas in August.
Everybody's getting, sometimes, I don't know about you guys, but in the summer I'm on vacation, I get a little lax,
Oh, it is my birthday month.
That's
so
right.
We're celebrating. Everyone can get a gift for themselves.
And then wait no more. Take $50 off a weight loss consult with a member of our wellness team. Whether that's Elfie or whether that's our nurse Jennifer or Dr. Sarna, but usually Elfie and Dr. Sarna do those weight loss consults. $50 off. So if you kind of overindulge this summer, it's a great way to get back in shape and ready for the holidays. So,
and we do offer semaglutide and those kind of injectable things that are all the rage. So they've been very busy getting a lot of calls about that.
Yeah, and I know we're going to talk a little bit about this today, but Paradise has something new.
Oh boy!
We love new toys.
Yes, we do.
Especially Dr. Weiss. So we bought an Elocore device.
Yes,
it's a microcoring device, and we'll talk a little bit about that. But next month on September 13th, that's our Wind Down Wednesday, we'll be talking more about Elocore. And Dr. Weiss has had the opportunity to treat a couple of our staff members. So that's exciting. We're getting to see how they heal, and they are having 0 problems with it.
Yeah,
so,
it's been really fantastic. And Maddie actually just posted a TikTok today, so if you want to see me in action using the Elocore device on Elfie here at the office, that video is available for you to see. And you can go on the Elocore website too. They have lots of before and afters. This device, I'll just tell a little bit about it because I can't stand it. Okay, so this device is first of its kind micro-coring device. So super smart people at MIT and Harvard, they designed this device. They figured out the exact width of a little punch biopsy that you won't scar, that won't leave a scar. And so if it's under 0.5 millimeter, which is what these little microcores are, it's a scarless procedure. So you can remove lots of these little microcores from the skin, and they start closing almost immediately, so everything tightens up around them. So it's almost excising skin, much like a facelift would, on a smaller scale, of course, but without the scars. So you're not going to be left with the scars that you typically see with patients who have facelift surgery. You'll see results after one treatment. The older you are or the more laxity you have, you might need more than one session, but you will absolutely see results, with a single session. And we're watching our staff heal. We've treated a couple, and honestly, the healing time is a lot faster than I thought it would be.
Yeah.
So people are healing up really quickly. You do obviously have some redness, you have some evidence that you've had something done, but it's nothing like you would think when you're removing 5, 7, 8% of skin.
Yeah.
So we're super excited to have it.
We actually have some questions coming in
Okay.
really fast.
Exciting. Tell us, Maddie.
So someone's asking, what is the recovery time of this treatment? So like the downtime.
So I think real downtime is about a week. I think there will be patients, if you tend to be you have red undertone, you might stay red a little bit longer, but you can start putting makeup on after a week, so there's no reason why you couldn't go out and cover that up. Some people could stay red. Obviously, worst case scenario, you could be red for a month in the treated area, but it doesn't sound like the majority of patients have that experience.
Yeah.
Yeah.
And then the next question, how would that perform on stretch marks?
Great. They're using it on stretch marks. They're using it on laxity on bellies, on thighs, on arms, all off-label, because right now they only got their initial FDA approval for the lower face jowl area, but it is being used off-label all the way down to the clavicle and on body areas on the, like I said, on the abdomen, arms, thighs, stretch marks, scars. So I'm so excited to see what this device can do. It really sort of bridges that gap between traditional laser resurfacing, energy-based treatment. This is not an energy-based treatment. It's literally just coring out using hollow core needles, coring out to various depths depending on the thickness of your skin. It's coring out, a percentage of the skin and removing that. So again, it's sort of bridging the gap between those energy-based devices and facelift. So that's like right there in the middle. And it's just done under local anesthesia. I actually found it to be less painful for patients than even the laser because there's no heat.
Yeah.
Yeah. And so we numb you real well and you don't feel a thing.
And I'm really excited because Dr. Weiss and Peyton are going to treat me at the end of this month.
Yes,
We're going to do the lower face. We're going to do the neck.
Yep.
So I'm really excited.
There's not a lot of contraindications to the procedure, but if you are interested in it, the one contraindication is to not be on any blood thinning agents for the 2 weeks before the procedure. So just keep that in mind. But definitely urge you to schedule a consultation and we can go over all the ins and outs.
Absolutely.
So that's Ellacor in a nutshell. But I mention it, and it's, well, one, because it's our topic for next month, but also because of its ability to improve the perioral area. So that's, on the table for discussion today. One thing I really love about Ellacor around the mouth is that as we age, it's called the ergotrib, which is the length between the bottom of your nose and your upper lip that lengthens as we get older, and we lose bone around our jaw, and so things kind of recede, and that's part of the reason we get those perioral lines, those smoker's lines, even if we're not smoking. And this device can really do a very nice job of even shortening that distance, so it gives you almost the look of a little lift, like a lip flip.
Yeah.
And can do a wonderful job for the nasolabial folds, pulling those back. Almost looks like you've had filler.
Yeah.
In addition to what it can do for the jowls, but
Yeah.
Loving it.
Yeah, I'm excited. And this area is kind of a tough area to treat on some people. So many women come in and tell us during their consults, what can we do about this? I've never smoked. I don't drink through straws. What is it? But they don't realize that we have that bone loss there. So this is exciting. I'm excited to compare this with, to pair this with resurfacing.
Yeah.
So if someone needs improvement in their texture, but they also need some tightening.
Yeah, I think, I think at this point, because it's new technology, I don't feel 100% comfortable doing CO2 and Ellacor on the same day. But I think absolutely you could pair those things together to separate them, so that really it's like the best of both worlds. And maybe you don't need a second Ellacor, but maybe you do a CO2 down the road, right? On the skin that's remaining. So I think I'm going to be doing a lot of combination treatments. I could the same day treat with CO2 in areas that I'm not treating with Ellacor.
Sure.
So for example, if we're treating lower face jowls with Ellacor, there's no reason why we couldn't do CO2 on the eyes or the forehead areas. And I imagine a lot of people are going to want to do that because the downtime is about the same.
Yeah, why not?
If you take a week off, you may as well do them both.
Yeah.
So that's exciting.
Yeah. And I guess it depends too where you work. We're lucky we work at a med spa, so the girls can come to work here and I will be at work here with just, little track marks, if you will, that are on my skin temporarily during that week while I'm healing, right? So depending on your work environment, or whether you work at home and whether you're on Zoom, how acceptable it may not be a big deal to you, know?
I mean, our girls come right to work and it's like they're a walking billboard. We had somebody just like lay down money yesterday, like, how soon can I get in for this? Because they saw Charlie. So it's a funny thing about performing treatments in an office like this, because people are like, well, what did he do and when can I have it?
Yeah.
It's not like people are recoiling in horror.
Right.
They're signing up. So yeah, so it's super exciting, brand new technology, and I think this is what a lot of people have been waiting for, because there hasn't been anything super great with skin tightening.
Right.
Like it's always been kind of meh, like the results are okay, and you need a lot of treatments. And so, I think Morpheus 8 is probably as good as it gets. If you're looking for an energy-based skin tightening treatment, Morpheus 8 or something RF microneedling. I think the non-microneedling RF treatments are really just they're not great. We had Ulthera in the office for a period of time, and some people did get nice results. Other patients didn't get much, and it was uncomfortable for patients. So we stopped offering that for that reason, because I couldn't really, guarantee improvement.
Yeah.
And so, and it wasn't inexpensive. So you're spending, as much as you would spend, quite honestly, on an Ellacor.
I'm doing Ellacor,
and maybe get results. With this, you will get results. I mean, I am literally removing skin. That skin is gone. You're not waiting for new collagen deposition, which can vary from patient to patient based on, your health and age and all of that. So, that skin is gone. It's sucked up into a vacuum and never to be seen or heard from again.
It's a messy business, but we take care of it all.
Yes, no worries. You're not going to walk out of here looking bloody or anything. So, but yeah, and like I said, you heal up amazingly quick for the type of procedure it is. Yeah. So, super exciting, yay.
Yeah.
Okay, so what else can we do for perioral rejuvenation, Peyton?
I usually like to use tox and filler to kind of help with certain areas, like your DAOs. I think it helps relax the muscle back up, and then you can kind of fill in those and kind of reset that smile to knock downward.
We don't like the frowny smile.
I love using toxin in the lower face.
Yes.
I feel like it's a game
effective.
changer. Yeah. So treating the DAO muscle, which is the muscle that pulls the corners of the mouth down, to relax that, so you look like you have a more neutral lip. Treating the chin.
Chinulite.
The chinulite. Treating the upper lip for either a lip flip or to treat those lines. Works also very well. Peyton put out the Daxify, probably on purpose, I imagine, because it lasts a little bit longer. And that is one thing that we see around the mouth. You can't use a really high dose because you might feel like you're not. Obviously, tox affects function, so you might feel like you're talking funny or something, especially when it first kicks in at that 2-week mark. But Daxify offers a nice option that you'll get a longer lasting result. Because I think with the typical tox, I don't know how long you're seeing it last, but maybe 6 weeks. Yeah.
I did Maddie's tox, her lip flip with regular tox, and I've done Daxify, and her Daxify definitely lasted a lot longer around the mouth.
Yeah.
So.
And lip filler also, when you do lip filler, it looks so beautiful, and both of you do beautiful lips. It doesn't last as long as filler in other areas of the face because we move. Is that because we move it?
It's such
so
a
much?
mobile part of the face.
Yeah.
You're always. Look at me. I'm always talking. You can't shut me up. So you metabolize it much quicker than filler in other areas. But I think treating the vermilion border, if you need it with a little bit of filler, you can go right into the lines, the smokers lines, with the correct product.
Yeah,
so that you don't leave little
very
skin
thin.
bumps. Right. So Redensity, I really like Redensity. What do you
my
like?
favorite.
Yeah.
Because there's no tindle either.
Yep.
It's just nice, soft.
I like
That's very
Bellatero, I like
natural.
Redensity, I like Refine.
Refine's good.
Those are all really nice options. Volbella, I feel like I don't love for upper lip, but I do like it in the lip or the vermilion.
Yeah.
For someone who just wants a subtle lip, sort of
Just
more
a
of a
little hydration.
smoothing, like a plump,
Yeah.
as opposed to a real fill.
Right.
I think people are looking for more natural looking lips these days. They're not
Right.
looking to get those huge
Yes,
lips.
big lips are not in anymore.
Yeah,
They're not.
No. Peyton
Not
did
that
an
we ever
amazing
did 'em.
job on lips. So if you are looking for lips, get in with Peyton. But I do love doing lips too. But you know what's funny is the more I have injected, the harder I find lips to be. I think they're the hardest to get them just right.
Well, and everybody has different shapes, right? Oh, and the asymmetric,
Yeah, everybody's
That baby.
asymmetric, and they're then expecting to be symmetric all of a sudden afterward. That isn't going to happen. Just so you know, if you come in and you're asymmetric, you're probably going to leave asymmetric because the asymmetry is caused by lots of things. You could have a stronger muscle on this side pulling up your lip. I see that a lot, which actually comes to think that you can treat some asymmetries with tox.
Yeah.
So you've got a muscle called the LSAM muscle, which sits right here. It's the one that kind of pulls up and causes those bunny lines. But it also causes gummy smile. So treating that also is really good for
right
talking
here.
about perioral rejuvenation. If you smile real big and you see all your top gum, not everybody loves that. So you can calm that effect down with a little bit of tox placed right here.
Also the columns.
Oh yeah.
Oh yeah, right here, right.
You'll put in a
These
little
two?
bit of filler. Like if you're flat here,
Yeah.
which happens again as we age and things kind of fall, but you can restore those little filtral columns with filler. So that's really nice.
Yeah,
And
that
I think
looks
patients love it.
Yes.
Yes, they love
It's a
it.
very
Just gives that shape.
small detail that
Yeah, people
really-
miss.
they forget about it.
Yeah, I think it gives a more youthful look too.
And
You
you
know?
even just put a little filler in the corners of the mouth, just to support the corners so you don't look frowny, like to turn that frown upside down. So that's also really nice. And sometimes people will feel like they've got marionette lines, but all they really need is just a little support in the corners of the mouth.
Yeah.
What about chins? Do you like doing chins?
I do. I
Yeah.
think they really affect the whole face.
Oh
I
yeah,
think
because
that,
it can make you look
and you can
down.
add just, such a small amount, and it does so much for
I
the
know.
face, and it brings the jawline out, and it helps with the the double chin appearance to look smoother.
I think it's one area though that people either recognize that they need it and they come in asking for it, or they have no clue.
They've never even thought of it.
They've never even thought of
Because you
it.
don't see yourself from the side.
Right, because it is something that we see people
Yeah.
in 3D.
Mm-hmm.
And they see themselves in 2D when they're looking in the mirror, and they don't realize that it's the lack of chin projection or definition in that area that's really causing the jowls or the other things that they might be not liking. They just don't. I think a lot of women in particular, they have smaller facial structure, and so as they age, they look more round because they don't have the length of their jaw.
Yeah.
Men have typically stronger jaws, but women, everything just sort of falls. So it's real unfortunate. Women get the short end of a lot of
We do.
I know our face falls off. But that's Ellicor can help that too. Take off all that black skin. The other thing is plasma pen.
Yeah.
Plasma pen is a really nice option to treat those lines. I think if really that is an area that bothers you and you're not looking for full face resurfacing, plasma pen's a wonderful option. And you could do that, and I do that, in conjunction sometimes with CO2.
Right.
Just because, laser resurfacing for the texture above the lip can only go so far, especially when it's fractional laser resurfacing. And that's pretty much what we do here, just because the downtime is less. You can do fully ablative resurfacing or those full thickness chemical peels.
Right.
Those work wonderfully for those lines. However, you may see lines of demarcation and you kind of get that waxy look. It's something to take into consideration. You really have to resurface to a pretty deep level, consistently across the whole lip to get those kind of home run results with resurfacing in that area. So we often combine different modalities like plasma pen, like CO2, now Ellicor, to get you the best result with the smallest amount of downtime.
Yeah.
What else?
What about threads?
Yeah, smooth threads.
Lower face.
Love it. So, lifting threads for lower face just to kind of help for jowls. But I do like using smooth threads in vermilion border above the lip for those lip lines. It's a really nice option. Smooth threads are you can hardly see them, they're very fine. But they just give you that collagen stimulation, helps for those, those difficult to treat areas. It's another modality that you can have in your tool in your toolbox.
Yeah, so we've got tox, we've got filler, we've got threads, we've got laser resurfacing, we've got Ellicor, we've got plasma pen.
Yeah.
What else?
Well, there's all the other things that we like, just wearing sunscreen. How about that? And
how about using retinoid?
Yes.
At night.
Using good skincare products. Doing your maintenance treatments, your Morpheus 8, your Neoskin, your chemical peels, your Clear and Brilliance. Starting young. Start young. Don't wait till you get all of those textural problems around the mouth to then start treating and trying to turn back the hands of time. It's always easier to prevent than to treat. the other thing is keeping up with your dentist. So making sure you're getting regular dental checkups. I am the pot calling the kettle black right now. I'm way overdue for mine. But you know, from a cosmetic standpoint, you know, you don't want to be losing teeth.
Right.
Because then things really shift, and keeping your teeth white and pretty and all of that helps your smile. So I think all of that goes into it.
Yeah.
Because you could look great with your mouth closed and then you smile and you look horrible. So it kind of ruins the whole thing.
Yeah.
That was good in 2020. You could wear the mask.
Yeah.
Right.
No, you can't.
No, you can't.
Yeah.
Sorry. Yeah. Any questions coming in, Maddie?
Not right now.
Okay.
Okay.
So yeah, I think all of those things go into, don't you?
Yeah, absolutely. And you know, it's funny, anytime we come out with something new, I find that people will ask me, well, Janet, does this mean I don't have to do my filler anymore? Or does this mean I don't have to do my tox anymore? And I always like to explain to them that, and I've gotten this from you, Dr. Weiss, from doing consults with you, that aging is a multi-tissue issue.
I knew you were going to say that.
So, you know, we have the bone loss, we have the fat loss, we have the collagen loss, we have the elastin loss. And so we're using these different modalities to be able to get you further and further faster. And I always think of it like an orchestra. You know, you don't have an orchestra with just violins. You know, you need all of the different instruments to get the best. I mean, violins are pretty, I love them. But you get so much more when you have the orchestra. And to me, the orchestra are all of these things that we talked about.
Yep, all of them, because it's, you know, the tox is addressing the muscular activity, right? The expressions that are creating wrinkles or, you know, affecting our expression on our face. And then you've got your filler, which is restoring the lost fat, the volume loss that happens. And then you've got things like Sculptra that can restore collagen, which can also help, like I said, for smile lines, which is all part of that.
Yeah.
You know, you've got bone loss, which Sculptra can help as well. Even hyperdilute radius can help those kinds of those biostimulatory treatments. And what I didn't mention is Renuva also for fat loss.
Right.
Oh,
yeah.
You can't use it in the lips, but you certainly can use it
Yeah.
anywhere in the face other than that. So that's a really nice option as well. Longer lasting. I think we've talked about Renuva in the past, but it's the scaffolding around which your fat will grow. And so we can inject that, and then you can grow your own fat. So a lot of these more natural treatments are available now, which we're super excited to have.
Yeah.
We're one of the only offices to have that too. I fight for these things.
That's right.
No,
We track these people down.
I
Dr.
know.
Weiss
We're like,
tells me about
hey,
it. We track them down
want
for a
that.
year if we have to.
That's right. So yeah, so there's all these layers that you're talking about, and then there's the resurfacing, and then what we didn't talk about was like IPL.
Right.
So to get rid of dyschromias, to help for redness, to help for brown spots and things like that, because that can affect the lower face around the mouth too. So doing photofacials and things like that to help. That's I feel like is always like the icing on the cake to make it all look nice and smooth and clear.
Yeah, because you do look more youthful when you have this even skin tone, right?
Yeah.
It does make us look older when we have this splotchiness, if you will, even if it's not red splotchiness, but from those, you know, browns, from the reds, you know. If you've got thin skin, then you're gonna get, you know, you're gonna appear more vascular.
Yep.
So.
Yep. The one thing I didn't mention when we were talking about filler is Kiss. I do love me some wrestling Kiss.
Oh, both of you do. I have to watch these too.
Yeah, so I use
sure I
a lot
keep
of that
on.
when I'm doing lip filler. Not so much like around the mouth, but
Right.
in the lips. I really love it. It's so pretty. I do like RHA 2 and 3 as well. So there's some really nice options available now.
Yeah.
Even contour.
Softer appearance.
Contour if you want like a more robust fill, or you need a more robust fill in the lips. I do love me contour too. It's off label.
Okay.
I love it.
Yeah.
Yes.
Nice.
Did we miss anything?
I don't think so. I mean, really, because we talked about resurfacing, laser resurfacing with CO2, which really has to do with the texture and the tone of your skin and the pore size. So it really helps to make that look more youthful.
Yep.
So.
Yep. Love all of that. All together. do
Yeah.
all that.
Do all of it.
Do all of that, and don't drink from straws.
Yeah. But don't smoke.
And definitely
also
do
true.
not smoke. And wear sunscreen. Yes.
Yeah. No, but I think I'm excited about all of the offerings that we have here, and I think the beautiful thing is we can go as slowly or move as rapidly as makes sense for a patient, depending on what their goals are. If they're like, oh my God, my kid's getting married in 6 months. I wasn't prepared for this. We can get them ready. If someone's just like, you know what, I'm tired of looking this way and I want to do something for myself. I'm an empty nester now, and I'm ready to do it. We'll go as slowly or as quickly as they need us to.
Yep. So we're not a one-trick pony. We have lots of options, and we customize them to each patient. So and the 30-year-old isn't going to need what the 70-year-old is going to need. So we really encourage people to book consultations so we can make a plan for you.
Absolutely. And then if anyone's ever interested in just talking a little bit about it, they're not sure, they want to get an idea of pricing, they haven't done this type of thing before, I'm always available to give people, I can always give you an idea of pricing. We can kind of talk about your concerns and
I think that's good
figure
to
a
make
little
that
bit out.
initial phone call sometimes too. Like if you have no idea, you've never done any of this, you don't even know how much it's going to cost you to do a syringe or filler. And if that's out of range for you, it's better for you to know that before you're coming in, so you're not like blindsided.
Right.
I think like preparation is key, and then when you're ready in the future, we're here for you. So so do your research. Obviously make sure that we're a good fit for you, which of course we are, but
we feel like we are.
Yes, but I don't want to say we're the only office in town. There's lots of good and bad out there, but so do your research, make sure you're comfortable with whoever you see. And we're waiting for you. We're here for you.
Yeah.
And we love this stuff.
With all our
we
fun
get excited about it.
I know.
We got everything.
We sure do. I don't think there's anything that we need. And so if you're a rep for any of these devices, please don't call me.
Yeah.
Because
Or
I
me.
am all up. There's nothing more that we need right now.
We need
Not yet.
We need a new building.
Oh, we didn't talk about is laser hair removal. Laser hair removal for your upper lip.
Yeah.
That's a good one too. So you can add that to the list.
Right.
Yeah, because
right.
it all goes to hell if you've got a mustache. That's what we'll say.
Or a beard.
Or a beard. Okay, well on that note, we are happy that you guys joined us. Happy that Peyton joined us today. We kind of sprung it on her. She wasn't expecting it, so but she's gorgeous, so she can just like put herself together like that. She's not old like I don't know this side of the room. And I'm including myself in that because I turned the big 5-0 last week. So, but anyway, it's all
nobody
good.
would guess if you didn't tell
about
me
it.
so.
I'm like,
Still upset.
just kidding. All right, I'm gonna
Thanks
drink
so
more
much.
wine. Okay, thanks
We'll
for
see you next
joining.
month. Thanks.